So I just wanted to say thank you all for sticking around. I felt like I was going to be talking to my staff after lunch with everyone leaving about the community health assessment. So I really appreciate you sticking around, and because this is a very interesting topic with the community health assessment. I think you're going to get a lot out of it because if any of you do grants or looking for funding, this is somewhere where you want to use our community health assessment for those funding opportunities and for some of the research that you're doing, because it really is, as you'll see, the health of our community. It's specifically for Portage County. So it's very individualized. So the 2019 Community Health Assessment, I was asked to talk about the Community Health Assessment, and our assessment right now is a draft. So our Community Health Assessment is completed every 3 years. So the first one that we completed was actually done in 2016. So hence, we just completed in the spring of this year, and also early into the summer, we just completed compiling our Community Health Assessment for the end of this year, which would be our 2019 Community Health Assessment. Right now it's in draft, so we have not finalized it, because what we do is we push our Community Health Assessment out, and we make sure that we get public comment, and people like you in the audience today, we want people to look at it, comment, provide recommendations on what those findings are. So I was asked to talk about, I want to make sure I get the right button. So I was asked to talk about our health assessment. Our current 2019 health assessment is about 237 pages. So I knew that when I started today that you would have been inundated with slides. So I'm not gonna cause a death by PowerPoint today. So I did pull some together that are more specific for things that I think you would find interesting, that maybe have the biggest percent changes over the years with substance abuse and mental health. But I do want to mention, and I don't think our superintendents are here right now. I know we had one or two, I saw one or two that were here. The health assessment, what it is a compiling of information. So how do we get that information? We send out surveys, and we contract with a third party that does this for us and does all the data analysis. So we send out surveys throughout Portage County. It's randomized surveys for adult information, for youth information, and for child information. And of course, the adults answering for the child. You don't ask the child to answer the questions. So when we send this information out, that's one of the sources of information. We also get local data. We also get, and for this 2019 assessment, we got hospital data. Because we asked the hospital, we said, hey, we're doing this health assessment. We are serving the same populations. We need you to partner with us. We need the hospital data because it's going to strengthen our community health assessment. We also got the local data, like I mentioned, like our hospital. We also get state data and national data. So we are comparing Portage County residents, not only in Portage County, we can compare them to other counties, what's happening in other counties. So basically we're comparing to national data and state data for some of the information that we're collecting. With our schools, as I'm mentioning, am I going in and out? Can you see? Okay. With our schools, I just wanted to mention that all 11 of our school districts for this health assessment participated. So every school in Portage County participated. I talked to all the superintendents, they all 100% participated, and then Maplewood said, hey, we want in on this too. We want to be part of this. So I really commend all of our schools in all of Portage County, because this does not happen in every county, where you get all the schools to participate in the youth data, to administer questionnaires that are kind of, behavioral and health risk questionnaires to the students. So I really want to commend our schools. Maplewood, in 2016, we only had 6 schools that participated. So we're really not able to compare data sets. It's not going to be as strong, but the data is there. And we're grateful that they're all participating now, because now for 2019, we have more robust data. And the schools, one of the points that I mentioned to the superintendents is you could use this data for some of your grant applications. That's the big asset of a community health assessment, is using the data. Just because the public health is leading this effort doesn't mean that it's ours and this is, that we have ownership, because none of this would be possible without everyone in this room and our other community partners, because that's what makes it robust. Okay, so here's one of the summary slides that I wanted to show. And I'll go back and forth, but what you'll see is for this adult trend, and we did some adult youth summaries. So for this adult trend summary, what you're gonna see is, and it's the same on both sides, but what you're gonna see is 2016 data. So for 2016, 2019, you're gonna see Ohio data and US data. And for each one of these, they're all gonna be marked the same. So for this adult trend summary, we asked, one of the questions that was surveyed, general health, that you rated your general health as good, very good or excellent. So what you're seeing is in 2016, people said, yeah, we think our health is really good or excellent. 83% said that. So for 2019, it rose to 88%. As compared to Ohio, which Ohioans said, because they're asking the same exact questions in other parts of Ohio, Ohio rated at 81% and the US rated at 83%. So we're a little bit equal or a little bit higher in Portage County that rated their health as excellent or good. When it comes to mental health, again, in the same grouping of questions that were asked, mental health, did you rate your mental health as not good for 4 or more days in the past 30 days? So in 2016, we had 27% of our folks answered that, hey, their mental health was not good for 4 or more days within the past 30 days. In 2019, it rose to 33%. In Ohio, it's 26%, and in the US, we're at 24%. So you can see for our citizens in Portage County, they're ranking that we're higher in both state and US for their mental health not being good for 4 more days in the past 30 days. For this particular trend summary, what we're showing here is the mental health status, your mental health status that prevents day-to-day activities. So you have such an impairment with mental health that is preventing you from doing your day-to-day activities. In 2016, we had 28% said, hey, I'm at that point where I have a mental health deficiency that's preventing me from doing my day-to-day activities. In 2019, it rose to 32%. The state of Ohio comes in at 24% and the US at 23%. So we're slightly higher again in mental health issues that's affecting day-to-day life or day-to-day activities. In Portage County, we're drinking too much. It may come as a shock to you. I know we have Thirsty Thursdays down in Kent on Thursdays. And maybe we need to change that name or change some of the connotations that we're issuing, but we're drinking a little too much. This is certainly something that we saw in 2016. In 2016, for our adults, 22 out of 100 were binge drinking. In 2019, 27 out of 100 were binge drinking. So we're increasing on the binge drinking. And this is for adults. Unintentional overdose, these are emergency, like I said, local data is very important. And this is part of why we comprise this and push this into our community health assessment. Unintentional overdose at the emergency department visits, this is from 2012 to 2018. Several hundred people go to the ED for unintentional overdoses each year in Portage County for UH Portage. And what you're going to see here is obviously with the largest number in 2016 at 402, in 2017 for 367, and in 2018 for 237. So quite a bit of visits to the ED with regards to overdose. And now you can see why some of the discussions that we had earlier were the hospital, mental health and recovery board, town hall 2 is putting such an effort on treatment, on medication assisted treatment. Because we're showing and demonstrating numbers like this. For the youth, and for 2016, this is showing in 2016 grades 6 to 12. And we asked our youth, did you ever feel sad or hopeless almost every day for 2 or more weeks in a row? In 2016, we had slightly over almost about 26%. And in 2019, we increased in our youth about 32%. And this is from grades 6 to 12. More alarming is we're asking our youth in grades 7 to 12, did you seriously consider attempting suicide? And surprisingly, in 2016, we were showing 18% of the youth that we surveyed seriously considered suicide. And in 2019, we had about 13%. 2019 was about 13% that seriously tried to commit suicide or was attempting it. So you can see that, and I'm just showing you a glimpse of the 237 pages of data that we have for our community health assessment. What I'm showing you is, and this is all going to come together, these are efforts that everyone in this room and others within our community, we could look at this data and say, point to this data and say, you know what, this is the reason why we need to do this program. This is the numbers. This is why we need to collaborate with those other agencies so we could magnify the effects of our funding so that it's not just me working on something from public health side, working on one issue, and I'm on a silo working on suicide prevention in schools, because we're seeing an increase. And we're even showing, to me, having any percentage here is too much. So it's very alarming to me. But this is why we do the community health assessment, and why and I'll talk about it a little bit more about our partnerships throughout the community for doing our community health improvement plan. Again, youth trends. This is, again, data that we asked for our high schools, middle schools, and high schools. So our youth, we're asking about drinking, consuming alcohol in binge sessions. So the blue designates middle school, binge drinking. So 3.7 out of 100 middle schoolers said that they binge drink. And in high school, 20 out of 100, shown in this green, 20 out of 100 said they're binge drinking for our 2019 data. Marijuana use. So we asked about marijuana use with our kids in high school, in middle school. So for 2016, our youth said 11 out of 100 currently are using marijuana in grades 6 through 12 for 2016. They're using it. Not that they've tried it, but they're using it. In 2019, we jumped from 11 to 18 out of 100 are currently using marijuana in grades 7 to 12 for 2019. So obviously a rise in the use of marijuana. And I'm sure you can imagine that there's probably several factors leading to that. You know, many states are legalizing marijuana. So you see it all over the media about legalizing marijuana, about the benefits of different things, maybe CBD oils. I mean, it's everywhere. You could put it into the vape pens. into some of the vaping devices. There's just so many things that are bombarding our youth. It's just incredible. And it's hard to get away from it, because you can't turn on TV without seeing some type of ad or something. Social media is just bombarding everything about marijuana. Going back to the adult trends, the ACEs, the adverse childhood experiences. The 3 types of ACEs include abuse, neglect, and household dysfunction. 1 in 4 of our Portage County adults reported having 3 or more ACEs. 25%. So those are all the slides that I have with regards to the data, because like I said, I didn't want to, it's 237 pages of data. I'm not gonna, I'd have you here for multiple days going through all the data. That was not my intent. I just wanted to basically identify some of the issues that I thought would be of significance to you. But I also want to mention that what we do with that data. So we collect this data, this community health assessment in 2016, and now Joe Diorio is saying, hey, well, okay, you have this data from 2016, now you're going to collect it for 2019. So we're redoing the data. We kept the same questions so that we can compare our data. In fact, we added to our 2019 data because now we have the hospital data. We have hospital data from patients. We have local data from some of the agencies that are in this room and outside of this room. And we combine all that information with the surveys that go out. Did anyone get a survey here, by the way? Did you get one? One person. So you got one of our surveys? Did you get a $2 bill? Yes, you did. So anyone that got a survey, she actually got her $2 bills. Thank God, because I would have had to give you $2 today. Every one of our surveys, we send out multiple letters. It's a randomized survey. And when you get that survey, you actually get a $2 bill. And we've actually had people call, like I've had people call my office say, is this really a $2 bill? Yep, it is a $2 bill. So it's real, you can spend it. So what we do with this data, I talked about the 2016 data, I talked about the 2019 data right now. We're finalizing the 2019 data. We're gonna get this out to the public for comment. And what we do with this data is then once we compile this, which we were, I think it was in June, we finally completed all the collection of our community health assessment data. What we do with that then is we convene people like you and some of the people that are actually in this room today. We convene community stakeholders to hold several sessions, which we just concluded our last session yesterday, to look at how do we use this data, and by consensus, we use all the different partner agencies, and by consensus, we identify priorities. What are our biggest priorities from this data that we want to work on collectively across Portage County for the next 3 years to make an impact? How can we leverage our money? How can we leverage our staff? How can we leverage the things that we do day to day to make an impact on these areas that we're seeing an increase or a rise or very concerning issues in our youth or our children? So those 3 priorities are shown here on the slide. So what we do is we then put together a community health improvement plan. So from the data, from the community health assessment, we then convene this grouping of stakeholders, and it's open to everyone. It's not a closed invitation. We open to everyone in Portage County to attend this, and we send it out far and wide. And we convene over 4 different work sessions to come up with priorities. And for 2019, this is where we're at. We're coming up with these 3 priorities: mental health and substance abuse, chronic disease, and maternal, infant, and child health are going to be the 3 priorities. Those are overarching priorities. From those priorities, then we, over those 4 sessions of our community partner engagement, we then pull together measures and activities to make an impact over the next 3 years. It's a 3-year community health improvement plan. As you'll see with our community health improvement plan, when it gets rolled out, what you'll see is that we have some overlap because the state of Ohio also does an assessment, a state assessment, and a state health improvement plan. And what you're going to see in our new community health improvement plan is that anytime that you see this blue Ohio symbol, it's a crosswalk between our Portage County. So basically the measures, the priorities are the same. So you're going to see an overlap. So you'll be able to do a direct comparison of data between the state health improvement plan and our Portage County health improvement plan. Some of the cross-cutting themes, these are the three big priorities, but cross-cutting across all three of these, our group, our stakeholder, through our stakeholder process, identified health equity, access to healthcare, and social determinants of health as cross-cutting throughout the whole community health improvement plan. Because we thought it's hard to say that we want to do these individually. They should apply equally over all mental health and substance abuse, over all chronic disease issues, and over all maternal, infant, and child health issues that we designate through this plan. So before I conclude, I just want to show you one other thing, and that is where you can get this information. So we certainly post everything on our website, and this is our website. So you can go to, for public health in Portage County, you can go to portagehealth.net. So it's very simple, portagehealth.net, and it'll get you to our website. And I just want to show you, I could do a whole session on our website right now, but this is our main homepage. And what you're going to see is, like I said, it's very short. I've not kept it long. So this is the entirety of our main page. And what you're going to see in the middle are 5 areas: injury prevention, mental health, access to healthcare, substance abuse, healthy eating, active living. These were the 5 priorities from our last CHIP. So what you're going to see by the end of this year, I'm hoping to get our homepage adjusted to reflect our new CHIP process. So you'll be able to go to our homepage and you'll see our forward-facing site is going to be dedicated to our community health improvement plan for the next 3 years. And our community health assessment will be on there as well. So these were we went from 5 priorities in 2016 for a community health improvement plan to 3 priorities for our new community health improvement plan. But they're a little more encompassing, the ones that we chose. And then at the bottom of our website, you can always go to health data reports, and that's where you'll find the community health assessment, because that's where it'll be loaded. The CHIP, the community health improvement plan, and the community health assessment are located there. And then under each of those priorities, we have all the progress. So for the story that I want to leave you with is, in my conclusion, is that we started doing this in 2016. So we developed a 2016 community health assessment. We put together using all of our community partners, we put together a community health improvement plan for 2016 to 2019. We're concluding that project, 2016 to 2019 community health improvement plan. And what I want to leave you with is a story that, and I know that the folks that are in this room that have been to one or more of those meetings, we met every quarter for the last 3 years for that community health improvement plan. And we plan to do the same for this next community health improvement plan, where we meet every quarter to talk about the progress that we're making, to talk to other agencies that are in the room. And I will tell you that nothing has been more important than those quarterly meetings, because we get partners and collaborating agencies that come to those meetings that say, you know what, every meeting, I will tell you, we get someone that says, I didn't know you guys did that. I didn't know you did that work. And it's the conversations that are occurring at that quarterly meeting. I can't tell you how many countless agencies that we picked up to be part of that progress and that reporting out over these last couple years. Because we said, you know what, Sequoia Wellness does some of that. We know that they do some of that. Let's reach out to them and see if they can start coming to this meeting. And that's how we, as a community, are going to make a difference and an impact with our community in Portage County. It's not by one agency, it's the efforts that all of us make. And I think that's the true impact and the strength of Portage County. And I leave you with that. Thank you very much.